All right. Good morning, good evening on your end. Welcome to this session. Uh, we're happy to host this session through clinical practice foundation skills and Dr. Saga's assistance on the other side. My name is Dr. Dev Mannuru. I am an associate program director in an internal medicine residency program here in the US. I'm also uh, a clerkship director of one of the university medical schools here. I'm a hospitalist and an internal medicine trained physician. My passion has always been medical education. On those lines, I have realized that international medical graduates will benefit from a lot of stuff that our graduates in the US know on how to get into residency and beyond. So we started off an organization going by the name Clinical Practice Foundation Skills. So for students who haven't seen us or followed us, I encourage you to check us out on LinkedIn. We do a lot of work around medical education for the US grads and also for the international medical graduates. So Dr. Sega has followed my posts and has attended some of my interview sessions. In those lines, I discussed with Dr. Sega and asked if we could expand some of these educational uh, informations across her colleagues and even students who are still aspiring to look into the US for training. And that's how we put this session together. I'm going to hand off to Dr. Sega, and then she will kind of lead the session as we move forward. What we will do is we plan to continue to answer some preset questions that we have gathered from students. And then Dr. Sega will speak a little bit about step one and step two. We will give after that maybe about 5 to 6 minutes break for students to put in their questions in the chat box. And then we'll do our best to answer those questions as well. This session, we're hoping to close by 8:30 on my side, so that's about 1.5 hour total. Um, if you have any additional questions or things like that, uh, I would encourage you to send them to either Dr. Sega or me on LinkedIn, but please make sure to follow us so that you get updated information. It doesn't hurt. And at the same time, any information that you can get, which will help in your journey, is going to be only beneficial. All right, Saga, over to you.
Thank you so much, Dr. Mannuru. It is such a great honor to be here. Um, Thank you so much for even preparing the session, giving us your time. Imagine having 1 hour and a half. It's such a precious time. And but thank you for dedicating this. I have noticed that we Ethiopians, we have less access to information, especially with regards to, um, our path to residency in US. So thank you for taking the initiative even to do this, to give us time and to give us briefings from your experience. So I've met Dr. Manu through LinkedIn. So one thing I learned is that LinkedIn is a great source to meet such amazing and wonderful people who want to support our community. And then through that, he wanted to support Ethiopian medical students and then anyone who's interested in US residency, which is such a great opportunity for us, I believe. And the things he's been doing with clinical practice foundation skills is amazing things. So you can go in, check him out on LinkedIn and check the website and see things you could do as well. So for this session, we plan to divide it into 8 topics, like 8 paths to starting our residency in US. So I'll be starting we've prepared some questions. So after I reached out to people in Ethiopia, medical students and doctors, they gave me some questions. So I tried to compile it. There were a lot of questions, but we tried to compile it and try to cover everything around it. So we've prepared 8 questions from the question pool. And after answering these 8 questions, we're going to go to Q&A session. So if you have any question, make sure to write it in the chat box. We'll make sure to address it. So the first question is, what aspects and what are the things we should focus on during our medical school training?
So, it's a very important question, Sagan. If any student is looking to come to the US to pursue further training, they really have to start that mindset and preparation from medical school. And I would say even a little before that as well. What do I mean by that is, see, when we go through medical school training, we do gain skills and knowledge about the subject, about how to use the subject in caring patients, and then some professionalism aspects, communication skills, and so forth. But what you have to focus on is how are you as a person? What's that holistic view of you going to look like when you start your US residency application? So that will not happen uh, right away when you think of it at the time of application. You have to prepare, you have to work on yourself, you have to do a lot of things during medical school so that you have enough information and enough to represent yourself on an application. So in addition to good academic standing that you should aim for during your medical school training, you should also try to work on getting some research skills. So, research skills are not just publications, but these are all about, okay, how am I developing my skills around conducting research? What do I know about epidemiology? How much do I know about statistics? How can I understand to write a manuscript? How can I design a study? So these are some of the things you should start working on from medical school training, because i- those are the things that are going to help you if you plan to pursue your further training and practice in the US. Number one, it doesn't matter even if you're not practicing in the US, good research skills, if you work on them during medical school training, will always help you. Number two, genuinely look at what is your passion. Obviously, there are things you do for the test and there are things you do for your personal development, right? So when you read a subject, you read it thoroughly, but when you're reading the same subject to write a test, you read it differently, correct? So the same way, you have to look into yourself and figure out what is that passion in you that you want to take it to the next step, because that is what people are looking at when they want to identify those good candidates. So if you're going to do, oh yeah, I'm going to just do volunteership, I'm just going to do leadership because they will look nice on my application, they will for sure, but that's not what you want to focus on during medical school. You want to focus on what is your talent, what is your liking, what is your strength, build on that. So, those are the big things I would encourage students to think about and also work on during medical school. Another thing, please avoid gaps. Okay. If you are not prepared for a test, I would encourage you to just hold back, prepare properly, and then take it versus failing the test and then retaking it. A fail sometimes doesn't look good. That's my short answer on the things
Yeah.
that students can consider during medical school.
Thank you so much, Dr. Mannuru. Just to give you highlights on the experience in Ethiopia, most of us start this journey after we finish medical school, like 99% of it. And I think the points you raised, like focusing on our passion, what we want, and especially getting information is the key thing to even have a confidence to start that journey in medical school. So try to gather information in medical school and do the above things. That's amazing. Thank you so much, Doc. The second thing is, can you please elaborate the roles of USMLE score and the importance in
Yes.
residency application? Yeah.
So USMLE scores are among the top factors that programs use to identify potential candidates to even offer an interview and also to rank a candidate. So they have a good weightage when programs are looking at your application. It's not the only factor that is considered, but it is one of the important factors. There are, as you already are aware, there are three steps: step one, step two, and step three. Saga will speak about step one and step two as we go forward, but in brief, step one's move to pass or fail. So there's no percentile or there's no three-digit score that is meaningful, or in the sense that that's obvious to programs. It's either you're a pass or you're a fail. So when you're thinking of step one, make sure that you are well prepared when you take the test, because you don't want to fail. Even though it's a pass or a fail, you don't want to fail and then you pass the next time. So make sure you pass it the first time. Number two, step two scores. Generally, a lot of programs have a cutoff of around 230 or 220, depending on which program. But they might have some additional, internal expectations that they might look at. But in general, for a screening purpose, a lot of internal medicine programs do have a cutoff of around 220 or 230. So if you fall below that, your application might not be picked. Now, if you're thinking of a different specialty, like surgery, they might have a different cutoff. I can't tell you that, oh, this is the cutoff that one program uses, because there are close to 6,300 or 6,200 residency programs in the US. And they're not in a binding that they have to have a certain cutoff before they take a student or do not take a student. Then the next thing is step three is a very pivotal exam. It carries substantial benefits for international medical graduates. And I would encourage students to finish step three as much as possible before the start of residency. Why? Once you start residency, there is a exam that you will end up having to take like within 3 months of your start of residency, which is called ITE, in training exam. And you will be kind of mixed. First, trying to learn the ropes of residency. Then two, you'll also try to be working on step three. And then three, you have to have a good score on the ITE, which the programs do look at in the sense to understand the students. So obviously, there's going to be a lot on your plate if you don't get step three done before residency. Now, if students are seeking H1 visa sponsorship, I encourage them to complete the exam and receive results before the end of the interview season. You should update the status of this on the ERAS application and also notify the programs that you've interviewed and applied to. If students are seeking J1 visa sponsorship, completing this exam before the start of residency is not an absolute requirement. It is not. But I would still encourage students to take the step three as soon as possible and move forward. So, in short, step one is a pass or fail. Step two, there are some cutoffs that programs do use, but my sincere suggestion to international medical graduates is do your best. Uh, get a really good score. Now, what is considered really good score depends on the specialty that you're looking at and depends also how competitive you want to be. Sky is the limit, I would say. If you can hit 270s, excellent. If you cannot hit 270s, it's not the end of the world, but you need to have something above the 220s, 230s minimum. And step three, scores are not really looked at by residency programs to choose students. But a passing of step three will always help international medical graduates.
Thank you so much, Dr. Manu. I think the issue is most of us, we don't have a visa already. So it's not easy to obtain US visa to take these exams. And I think that's one of the hindrance in the applicants not to have a step three score already.
And a lot of international medical graduates it's the same situation, Sega. So even if you take from India, Pakistan, or any other country too, it's not easy to get a visa. I've seen so many people who've missed visas. I mean, cancellations, and then they get them. But whenever you can, it is always good to get that done. And the only time you have to come in now is for the step three. Before, in addition, now you also have to look for US clinical experience and stuff. So obviously, there's a lot on your plate.
That brings me to my third question. Can you tell us about US clinical experience, or USC in short, and the role in residency application?
Yes. So I'll give you a hypothetical situation. Okay. Uh, let us say I am a medical student in the US. Okay. And you are a residency program director in Addis Ababa. And I want to come and join Addis Ababa Medical School University for residency. And you have two spots, and you have 10 candidates. 9 are from Addis Ababa who have seen that same school, same system, everything. And you have me, one, huh, who's from outside, who doesn't know anything about Ethiopia, who doesn't know anything about Addis Ababa, who doesn't know anything about the medical school. How comfortable will you be choosing me? It's a
Would be
challenge.
really tough.
Yeah?
Yeah,
Yeah, go ahead. And you only have two spots, okay?
it would be really tough as a program director.
Right? You have 9 of students that are from your school or from that whole area. And then you have me, one who doesn't know anything about Addis Ababa. But I'm good. I have good scores. I'm a good person. How? You will still be worried, right? Or you might still, I'm not saying worried, you might think, okay, will the student be able to understand the situation quickly and move forward? Will the student adjust to the system of Ethiopia and Addis Ababa? Will they be able to adjust to the culture here? So those are all the things that people are thinking about when they think of international medical graduates. I didn't know all of this, Sega, when I started. When I started, I didn't even realize that, okay, people might have problems or people might think about these things before they offer uh, candidates interviews and stuff like that. I didn't think of that because this is the reason I didn't have that awareness, or that part of my brain was not developed then. And there was nobody to tell me like this. So that is why I wanted to share with the group that US clinical experience, one, it is a broad statement. So when you think of US clinical experience, It can be observational, it could be hands-on, or it could be virtual. So there are three types. Clinical experiences expose international medical graduates to the US healthcare clinical practice and the health system aspects. So you get an understanding of some of what is uh, you get an understanding of some of what is uh, US healthcare system, and then you also get an understanding of how is clinical practice pursued in the US. Then the second thing, you also get an understanding of what the community is like. So let's say I came to Ethiopia. I need to understand the culture. I need to understand the people. I need to understand the practices. I need to understand when I should say thank you, when I should say hi, when I should say bye. So those are all the things you get to understand. And they are important because if you're going to spend time understanding all of these things once you start residency, you're going to get a little behind. And it's going to be hard for you also because you're trying to figure out those things while you're also trying to fulfill your duties as a resident. So, overall, like I said, US clinical experience is important. Any type of experience will help you to understand the system. A good hands-on experience under an academic physician in a good hospital setting will definitely enhance your CV and chances. So not having US clinical experience can be one of the factors that programs might look at and say, okay, if I have someone who's got about 230 score with a good 3 or 4 months of US clinical experience, and I have another candidate with 230 score and no US clinical experience, I would want to maybe err towards this side versus the other side. But if that candidate has something else very different and they are excellent in some other things, obviously you would go there because it's a holistic review.
For sure. Yes. So as much as we can, if we find an opportunity, especially it might be in medical school as well. If we get any opportunity, let's try and have a US clinical experience, which is a plus for application. Thank you.
And
So I want, yeah,
one thing, second. So uh, you can look at VSLO pathway. So always look through VSLO pathway if there are any programs that are available there. Uh, you can check my posts. It's on one of the LinkedIn posts that I had put in maybe 1 or 2 months ago, where it's a pathway where you could look at obtaining observerships or rotations during medical school too. So something to think about. It's not feasible for everyone, I know. But if you do have that opportunity and you can, uh, uh, you know, um, you can you can do it, then I would encourage you to do that.
So there is three questions in one question for the next one. Can you tell me the role of research, leadership experience, and volunteer experience in residency application? What is their role and their importance?
Yes. So, see, uh, research is an integral part of training. Uh, it doesn't have to be that you are a research physician. It doesn't have to be that you're going to be a research scientist. But we just have to understand that a lot of the evidence-based medicine is research-based. So we as physicians should have the bare minimum skills to be able to at least interpret and use research data that's out there. So, irrespective of application, or path to residency, I encourage students to really learn research from the basics. So there are quite a lot of programs that can give you clinical foundation or some basic practice and principles in clinical research. So encouraging students to try to engage in clinical research is important. That's number one. Number two, if you're doing some sort of lab research, bench research, that is also good. It is not a piece that you can discount because I can't do lab research. So if somebody is really good at it, they need to work on that and continue to represent that in an application. And then number three, you do have to work on publications as well. Now, publications in general are not always that are published in the sense you can work on case reports, you can work on abstracts, you can work on quality improvement projects. You can work on, some studies. They can be retrospective studies, observational studies, randomized control studies. It doesn't matter. Any studies. And then if you've published something, great. If you have not published and they're still in the works, you can list them. So it's not just the ones that are published. The ones that are not published or in the process or in the pipeline, you can still list them. So just to recap on the research, one, research is very important and an integral part of clinical practice. Engage in mastering clinical research skills. If you get a chance, look for any opportunities to sharpen them. If you're doing bench research or lab research, that is also helpful. And then make sure to put out some work out there showing that you have those skills and you are able to use those skills as well. Now, if you don't do that and you're just putting out publications, that is a little riskier situation because I see a lot of students just going into somebody's case report and then, putting a name in there or doing stuff like that. That can get into problematic situations when you start training because let's say you come into the program and then I look at you and then I say, Sega, I know you did this manuscript. Can you work on this project? And then you can't do anything. That'll tell a lot of story about your honesty. So uh, do best, do your best on how you build yourself on the research. Now, leadership and volunteerships, these are two big questions. It is not absolutely necessary that if you don't like it, you have to go engage in some leadership. No, not everybody can engage in leadership. If you don't have that skill, that is okay. But if you do have that skill, you really have to know how to represent that skill. What do I mean by that? If you have leadership as a big thing in your life while you're doing medical school or even beyond, it should be one of the meaningful experiences in your application because you have to showcase that skill. Next, volunteerships. It is important. It is one of the things that programs look at. I don't like saying such things, but the society does look at all of these things when they make decisions on taking candidates. So I would encourage you to uh, engage in some volunteership activities, but try to make it a habit. See, for example, I'll tell you, if you have to lose weight, it's not just going to happen if you just think about it, right? You really have to work on it. And then once you work on it and you lose weight, in order to maintain that lost weight, you again have to work on it. So, the same way, volunteership is not something you're going to just check off. I can tell. If somebody is truly passionate about volunteership, I need to see that continuum. So, and giving back to the community is not a bad thing. So if you really don't have it yet in you, it's great if you can make that as a side thing and continue to work on it because it will only make you a better person also. those are the thoughts on research and leadership and
But
volunteership. But one thing I will like to add on is please remember, it doesn't matter that you have to follow the normal pathway. See, you don't have to follow the normal pathway of, okay, I have to check off research, I have to check off leadership, I have to check off volunteership. If you have a separate skill, let's say you are a, a, a lead singer in a band. Let's say you're a person who has a huge company on real estate, or let's say you are a person who likes to do stocks and you're a stock trader on the side. It is good to highlight such skills too, because it's not always necessary that you have to go down that same path everybody is trying to walk down. If you're a great cook and you have a restaurant or you done something on that, that's great. You can share that. As long as it's a meaningful experience and you've done it for some time, not just 2 days, 3 days, something beyond.
Yes, that's for sure. I've noticed that during the application season, many people consider these three aspects as a checklist, and that is not a good thing, as you highlighted, Doc. It's a good point because I noticed, like, out of nowhere, someone would ask you one of the volunteers you did or one of the things you did and make sure, and they could tell if you actually did it or not, or you just made it as a checkbox. So you highlighted it in volunteerism. You shall make it a continuum, not just get a certificate and or not just to get a recognition out of it, but it needs to be a continuum of your efforts and your desires to support the underserved. And that's a good point. And with regards to the research, I think in our medical school, so it's divided into preclinical and clinical. So during the preclinical attachment, there is physiology and there is biochemistry attachment. So if there are any medical students here, they could do some of the lab works along uh, with the lab technicians, and I'm sure they're under a research and there is some grant for sure in that laboratory, so they get a hands-on experience early on. So that's one thing I wanted to highlight in our setup.
Thank you.
If you could tell us about personal statements and if you could highlight it about it.
Yes. Personal statement. One, before you write your personal statement, understand the template on how the story can go. You start with your reflections on your journey from childhood. Sometimes you might not have some exciting things to start from there, and your journey might have started in the middle of your medical school training, or your journey might have started after your medical school training. So start your journey wherever you think is meaningful to start from, number one. Number two, give a glimpse of how your medical school experience was, or what sort of things you were able to identify as your skills or your competencies. While you're doing that, give a direction on how or why you chose the specialty you're applying for. So start your journey. It doesn't matter from childhood or any place where that click happened. Walk them through the medical school. Then next, bring them into why you choosing the specialty of choice. At the same time, you have to connect the link why you're coming to the US and share some of what you've gained out of the US clinical experience or your leadership or your singing skill or your cooking skill. How did it shape you? And then finally close the paragraph with what you want from the program and how you will be a good addition to the program. Remember, when you write a personal statement, You're not writing that final paragraph saying that you're going to be the messiah of that program. Never do that. See, you're coming into the program asking that you will be a good team player and you will contribute from your part, and you are going there to learn. You are not going there to say, I'm going to change the world of your program. I'm going to be the queen or the king or whatever. No, you're going there saying that I have the skill set, I have the experience, I will be a good addition to your resident cohort, and I would like to excel and move forward. That's the concept, right? I see a lot of applications sometimes saying that they're going to change the world in the personal statement, which is good. If they are really great people, I respect them, no question about it, but I'm not taking them for them to change the world, at least in the program. I'm taking them first to see that I can give them some good education while they give me back something from their skill set and experience that they carry. So that's in brief about the personal statement. And last thing I want to share about the personal statement is please proofread it. Make sure there are no grammatical errors. Sometimes when you look at it, you might think everything is perfect, but when you give it to your friend, you will see there is a mistake. They will pick it up. I have seen it even with myself. I've read some of the notes that I've made and I've thought, oh, everything is excellent. And then I give it to my wife and she'll pick 10 mistakes. So make sure to have someone proofread it beyond you, and don't use uh, AI to build a story. That's not good. The story should be yours. AI might help in streamlining it, or might help in checking on grammar. That I can't stop. That everybody does. But you shouldn't have an AI generated personal statement. That is wrong.
That's for sure. I think the program directors and associate program directors would know the pattern when it comes to a personal statement that is written in AI. So they have read thousands and thousands of applicants and they can notice the pattern. So make sure to be creative, start writing it. If you're applying for next year, start brainstorming about your journey, and that would be great.
Ex-
And I just wanted to ask you, Doc, can you tell me one personal statement that really outshined and like that made you call for an interview based on the personal statement, if there is any?
No, I don't have any like particular one Sega, but that's a great question. Let me think of it. See, I can tell you. See, in the past, when I first started as an educator, I always thought that the personal statement should start from their childhood. But I have started to realize over the years that life doesn't always happen from childhood for everyone. So it's not like, oh, I was walking down the road, I saw a patient, and then that just brought light into my brain, and I started thinking of medicine. No, I have gone past those stories. What I like, I can't tell you one personal statement, but what I like is that honesty. Or sometimes I've seen applicants just they keep writing, "Oh, I come from a small village, struggled all my life." Well, I see 500 applications and 200 have the same story. So it's not going to be meaningful. But I've seen some students who have one, I'll give you one example. I've seen a student who spoke about they started off their journey from medical school, and then they hit on a case that turned their mindset towards the specialty of choice, or they hit on a, a faculty that they were impressed by, and they gave me a reason why they were impressed by that faculty that made them solidify a decision on medicine. Then they showed me genuine efforts in that application packet, along with highlighting their competencies. So it was a well written statement. And then finally, that closing paragraph, for some people, they might like it one way, but what I liked in that paragraph was they said, I have all these experiences, I have all these skill sets, I have overcome this setback that has made me a stronger person. So I hope and wish to bring all of these to your program to enhance and enrich my learning and contribute to the community and the program. So the way they wrote that uh, was very respectful and still confident. So I think that was one personal statement over the recent years that touched um, my mind.
Thank you so much. So I think many people don't want to take the risk of being creative, but I think being creative would make us stand out.
Yeah,
And
absolutely. Yeah.
sometimes taking a risk and standing out of the crowd is there's a way to stand out from thousands of applicants. My next question is, can you tell us about ERAS application and how to prepare for it? I am seeing in the attendees, some of them are taking step 2 and in the process of applying for next year. So what are the things they need to do for ERAS?
When you're filling out ERAS application, please remember ERAS has an application guide. So before you even touch that application, please go on to ERAS website, and ERAS has an application guide PDF document. Open that and read it properly, probably months before you plan to start the application. Why? Because if you understand what you need to fill in, then you don't have to ask 10 people. And you don't have to depend on somebody's personal opinion on how it should be done. That's my first recommendation. And I have gotten whatever I have gotten about ERAS application by reading that packet. Next, highlight your awards. Highlight your master's degrees that you have done additionally. Highlight your postgraduate training if you've completed one. So you need to put them somewhere in that sections. You will learn. If you read the packet, you will know where to put them. Then the next thing is when you come to the experiences section, choose experiences that describe your skills, knowledge, and also choose them differently. So you don't have to pick the same type of clinical experience to share as meaningful experience. So let's say you have a leadership skill that you've put out there, that can be one meaningful experience. And then when you're writing the description of the experience, it is important for you to properly write that. What do I mean by that? Is one, you need to say where you did that rotation. Two, you need to write what responsibilities were you fulfilling. Then you need to highlight some interesting thing you fulfilled or did during that rotation. And then what was your sort of takeaway? So that's how you work on trying to get that meaningful experience and any experience in there properly written out. Another thing, just because there are 10 spots under experience section, you don't have to fill all of them. That's a guarantee. No residency program director will tell you you need to fill all 10 spots on experience under experience section. Don't feel compelled. If you write 7 and others write 10, that doesn't mean you're going to get less interviews. No, it's a package that is looked at thoroughly and properly. So don't think that, oh, if there are not more than, if there are less than 10, you won't get an interview. No, that was not what it intended to do when Eras created this 10 experience option. Last thing around this is impactful experience is something you should use. If you really have an impactful experience that you want to share, make sure to read the instructions and highlight the aspects you would like to. Candidates are not expected to complete this section, but if you do, it is a benefit too because people do look at it. Another thing, geographical preferences and location preferences. If you don't want to uh, uh, pick on those, that is okay. Because we, as international medical graduates, sometimes we don't have relationships and families out there. We want to get into a residency wherever we can so that we can follow our dreams and pursue our training and then do good to the community wherever we are. So that is okay. If you don't have a geographic or a setting preference, it's not the end of the world. It is optional. And finally, the signaling process in the application packet from 2024, the signaling is an integral part or inbuilt into the application. So when you're applying for programs since 2024, you have to signal or you can signal programs of your choice. Signaling and the number of signals that are allocated for each specialty are different. So for medicine, there might be 3 gold and 12 silver. For pediatrics, there might be something else. For family medicine, I don't think there are gold. So there are different models on how these signals are built for specialties. If you want more information, you can look at my post. There is one post on signaling from AMA, or you can just go to American Medical Association website and they have everything there. So signaling is important because programs do look at signaled candidates or candidates who've signaled them, and then they do review their packets first before they move to the next group.
Thank you so much, Dr. Mannuru. I've noticed the importance of experience section. So just to give highlights for everyone, ERAS has got sections. There is biographic section. There is a section about experiences, which has 10 parts to it. So you can write your life experience in 10 parts. And as Dr. Mannuru told us, it's not a necessity to fill in all the 10 sections, but you can't exceed beyond 10. So let's just make sure to spice it up. So not making it a chat box, like a chat list or like tick box, or let's just try to make it volunteerism, some from leadership, and some from our clinical experience. So that shows the whole picture of an applicant, besides just being a good scorer or like a good clinician. It just shows highlights of how a person can be. So my next question is, so we've come from a clinical, like thinking about USMLE in medical school. We went to USMLE scores, and then we talked about personal statement and the eras. Now we got to a point of an interview. So if you can give us highlight about residency interviews.
So interviews. I'll tell you, there are 3 big pieces to this puzzle. The first one is a compelling application. A compelling application includes whatever you've done before that for that application to become a compelling application. And also, it includes a personal statement. That's number one pillar. Number two pillar is the interview. And the third pillar is post match prep for residency. So these are the three pillars I always divide this journey into. So the second pillar, like I said, is the interview. Once your application is accepted by a residency program, they already know that you are an eligible candidate professionally. Now they want to know personally, how engaging are you? How invested are you? What did you actually read about the program before you got there? And how is your communication and professionalism aspects? So, an interview looks at all of these things. So, one, it looks at how interested are you in the specialty? It tries to figure out how interested are you in that program and why are you interested in that program? And then three, what type of communication skills do you possess? Interviews are very short span, right? They're not going to sit there for 24 hours trying to figure out what Mannuru is or what Sega is. They only give you 20 minutes, 10 minutes, 30 minutes. So you really don't have too much time to even tell how or what kind of a person you are. Having said that, you just try, right? So what happens is they're looking at all of these things, and then they're also trying to figure out your communication skills, and they're looking at your professionalism. So these are all the things you really have to look at and be prepared. Second thing, when you get to that interview day, make sure your background is good. Don't blur it. Find a good wall or find something that you can, clean up and then keep your background good. Make sure you are communicating properly. So, for example, I'll tell you real example. Let's say it's a little weird, but virtual interviews are like that. See, if Saga was standing in front of me or sitting next to me, then I'd be looking at Saga face to face and talking to her. But then here, it's so different. It's even hard for me. See, the camera is here. So when I look at the camera and I start talking, hi, good morning, how are you doing? Everything's okay, great, blah, blah, blah. Then, as if I'm looking at the camera, I'm looking at that person. No, I'm not even looking at the person. I'm looking at the camera. The person is right underneath somewhere. So that those are some of the skills you just have to train and build on. Even I don't have them perfectly put together. So I can't tell you that I'm an excellent uh, speaker on a camera. No, but I'm trying. See, if you look at me, I'm not even looking at Sega. I'm only looking at the camera, but it will look like as if I'm looking at Sega, right? So that is the trick. So learn how to practice in front of the camera. Next thing, there are nonverbal communication skills. You've seen me use my hands, you've seen me move my head, you've seen me turn. I mean, you don't have to shake your chair. Never do this when you're doing an interview. Don't rock your chair. That's wrong, you know. But you just have to use these hands and facial gestures and smile and those things should be good. And keep your shoulders up. Don't go like this. You're not there to serve. You're there to work together, right? So those are some of the things you need to know from a non clinical perspective on what you need to be aware of.
Thank you so much, Doc. I wanted to ask you to give me one example of your amazing interview you had with your candidate that made you rank them high.
So one, uh, I had a candidate who was very sorted in the sense I asked them tell me about themselves, and then they were very clear. They said, "I'm from here. I I did this, and This is why I'm in the US and this is why I'm in front of you. So that was very clear. Then the next question I asked them is, hey, why did you choose our program? And they were very to the point in the sense they just didn't go on saying, oh, your program is the best and your program is fantastic. No, they basically said, I like the program because I've done rotation here. I love the curriculum that you have. I love the faculty and residents that I interacted with. My family is here, and I want to stay and continue my life here. So, very sorted, right? There's no beating around the bush. Then I asked them what are the three skills they have. Again, very sorted. I have demonstrated high academic excellence during medical school and beyond. I am, yeah, what did they say? They said, yeah, I have unwavering interest in volunteership. And they did because they had served in a local shelter once a week for almost 3.5 years. So that's telling that they're committed, right? And then they had another skill they shared. So those were some things where you know these people are very well sorted and they will guide and talk to you. Yes, they gave one example here and there. How important is to give examples? You don't have to give example for everything. You only have 10 minutes. You have 20 minutes. So if you keep giving examples, you won't finish the interview and you can't tell everything you want to say. So reserve your examples to certain questions or certain situations because you don't have that much time like you used to have before when there were in-person interviews. See, these statements out there in the social media and YouTube and all of that about, oh, you have to give examples for everything. No, you don't have time. Think about it. In 20 minutes, how many examples will you give? You can't, right, Saga? You've gone through interviews now.
It will be really tough.
Yes, so you have to reserve your example for one or two things. That's it. And that example has to be very small and short and sweet.
That's for sure, Doc. One thing I noticed about Ethiopian applicants is I was actually in a meeting as well. Like we Ethiopians tend to speak like with a low voice. We don't like raise our voice and express ourselves freely. That's one thing we need to work on as Ethiopians. I guess that's one thing I noticed. It might be because of our culture, because we're not allowed to speak until we're told to, especially in schools, and especially in medical school, because there is a huge hierarchy and that we needed to respect, and we were not given a platform to express ourselves as well. So we need to really speak out loud. We need to, you know, speak our, and volume up. So that way we get recognized and, you know, they think of like the ways you're going to interact with their patient. So if you're
Hmm.
going to speak with a low volume and if you're not expressing some things you have in your mind, it would be really tough. That's one thing I'm working on as well. So that's that's one thing I noticed. And with regards to the experiences I have during interview, um, we're supposed to stand out. So one way to stand out is by asking important questions. I'm sure you've noticed, Doc, there are similar patterns of questions everyone asks, and it's like a similar generic answer you're going to give. So, but if you can ask a unique question, everybody would be happy to talk about it. And yeah, so what questions do you think is good as well?
Yeah, so good question. So I tell you, see, don't interview the interviewer. Okay. See, you are going there to be interviewed first. Obviously, you need to ask questions that you don't have answers of. Like, let's say you've reviewed the website thoroughly, you've gone through everything, and you can find an answer for that question, then yes, that is a good question. But if you have not at all gone through the website and you're just going to ask a straight question that is listed boldly on their website, then you've lost your chance because you didn't even prepare for the interview. So, one, don't go with the mindset that I'm going to ask 6 questions and stand out like a star. Two, make sure to ask the right question to the right person. So you can't ask, oh, what are all the changes you made to the residency program last year to a core faculty? That's a question to the program director. Then the three, make sure to ask a question that is only going to help you. If it is not going to help you and if you're trying to show off, it's only going to come negative. See, let's say you go to a community program and then they don't talk about research that much and they don't have research as a big undertaking. And then you go there and then the program director asks you, what questions do you have? And then you ask them, what are the RO1 grants or K1 grants that you achieved last year? And have you published in NIH or JAMA or NEJM? What will be your chance of getting residency there? Zero. Why? Because you already uh, really talked about things, one, they don't have. So obviously, they won't be able to serve you. If you go to a restaurant and that's a pure vegetarian restaurant and you say, yeah, I want chicken, they can't get you chicken. So they will say, okay, Sega, you can go to the next restaurant and have that chicken because we don't serve chicken. So you need to know what you're asking. Now, some good questions. What are you looking at in a resident? I don't know if that's really a great question, but one thing I can tell you, and it's this is are all personal perspectives, so don't quote me. These are just my 2 cents that I am sharing with you. Like one question could be to the program director, what is that one thing that you've implemented in the last few years that has made an impact in resident learning? See, please don't focus on well being. Residency programs are already focusing on well being. So you don't have to keep asking 10 questions on well being because then that is sounding recently, differently. So focus on things that are going to help with training. So ask them one thing that they implemented that enhanced residency learning, or one thing they are working on to enhance residency learning, or one thing they think is great about the program, something like that. Or you can ask them, I noticed that you mentioned there are away rotations. What sites do you offer for the away rotations? I noticed that you mentioned that there is volunteership opportunity. Where all can we volunteer? I noticed that you mentioned that we have research and scholarly activity opportunity. Is there a training course or some sort of a, fund that you can provide for posters? Because some programs do provide, some don't. So those are some good questions.
That's amazing. Thank you so much, Doctor. I can see some of our members here are on the process of interview as well. So that is really important. My last question is, can you tell us about post-match transition to residency because that's your area of expertise, and if you could tell us about the boot camp as well.
Yes, transition to residency is very important, Sega. It's not just for international medical graduates, even for US medical graduates. Transition to residency, quote unquote, statement came from US schools. So, what's been happening lately is I don't know if everybody understands the health system sciences aspect. So, there is basic sciences, there's clinical sciences, and then there's a third pillar that's called as health system sciences. So these are the three types of sciences that medical school students should be aware of. Lately, there's been a gap in people's awareness on the clinical practice relevant health system sciences topics that you are going to get exposed to as soon as you hit that door of residency from day one. If US medical graduates are still, in the process of learning and they're still trying to figure out transition to residency, imagine the state of international medical graduates. So, transition to residency is a very important aspect once you match. You need to know, uh, at least to a good extent, on what you're going to be assessed against, how, what are your responsibilities from day one, how can you enhance those skills being an international medical graduate, because you don't get exposed to the way these folks, my students here, get, practice and learn. So obviously there's a difference. So trying to get better at all of those aspects before you go into residency will help. Why? One, you'll be able to perform better. Two, you'll be able to care for the patients better. Three, you will not be very different from an international medical, from a US medical graduate. Four, you will be able to focus on subspecialty efforts. So if you want to do residency and fellowship, then you will have that time. And five, your mind will be peaceful, you will be less stressed, and your personal life also will be better. Because I have seen people struggle during the 3 to 6 months, and some overcome it and survive. Some struggle for a long time. And it is not uncommon. Even out of 100, I can tell you that at least two struggle to a point where they can make it. Probably two struggle to a point where they end up repeating programs, and probably two struggle in such a way that they have to uh, switch programs, and at least 10 might be just down for some time. So that's the state of how things can change if you're not prepared for residency. Now, all residency programs do provide onboarding. So 1 week of onboarding is provided by residency programs, but the onboarding will include a lot of things, starting from the hospital expectations and all of that, and you will be overwhelmed. So you should prepare a little more than just the onboarding that these programs offer, because at least a majority of the programs, to my knowledge, don't focus separately on enhancing international medical graduate skills. So that's the big thing. Clinical Practice Foundation Skills offers a lot of services, starting from personal statement editing to mock interviews to post-match boot camps. I would encourage students to check us out, because our mock interviews are going to be very different. It's not going to be like the run-of-the-mill mock interview, or it's going to be different. I don't want to say other mock interviews are bad or anything like that. I would just say we're different. So check us out. And then the post-match boot camp. Not everybody has the expertise to teach all these subjects and topics. I am a master in CDI. I have a title and I work in a professional role in quality. And I'm also an academician. So I have three different hats that I can bring to the table when I teach these topics to students. So make sure to check us out for post-match boot camps.
Thank you so much for answering all of my questions amazingly.
Thank
I
you.
cannot thank you enough. And so if that is okay with you, we can proceed with the Q&A.
Yes, we can.
Thank you. So I was asked directly with one of my friends. He said, Can we use AI to restructure our personal statements, maintaining our original stories?
Um, I, I don't think there's a wrong answer or a right answer here. I have used AI to check for grammar. I have used some part of a bit of AI maybe to restructure, but then I rethink about it and rephrase it. But I reserve AI use mainly for grammar and also maybe for some format checks. I would not completely rely on AI to develop the full statement. Although it might be your mind and your story, but let it not be a robot type personal statement. Let it have some sort of human touch in it where there are some maybe uh, flow of a sentence that's more human versus having some AI generated sentence that's so structured. So I think there has to be some touch. But the answer to his question, reserve it to limited use.
Thank you so much. Because once we get dependent on I feel like we lose our creativeness as well.
Hmm.
So there is no right or wrong answer. But
Yeah, no,
thank you.
you won't believe. See, I put some of my emails into Grammarly to check for grammar. And then, now Grammarly has AI in it. And it says, oh, generate AI, make it shorter, make it longer, make it this, make it that. I try it, and then you start getting used to it. And then you're like, okay, then you open the statement and it doesn't really sound like how you want it. So I usually proofread again what the AI sends and then change it again and then put it as an email. So that's that's how it goes. I'm not going to say AI will not be a part of everything moving forward. I think we have to accept that AI will be a part of a lot of things moving forward. It's already a part of a lot of things. So, but when you're saying personal statement, there's a reason it's being said as personal statement. So remember that.
Thank you so much. So another question I found in the chat box is, how is the accreditation status of applicants medical school going to affect the decision-making process of program directors? So as you know, Ethiopian's medical school is not accredited. It's in the process of being accredited. And how would that have an effect?
So as long as you are able to go through as an applicant and you've got the ERAS token and you have all of that. Programs usually don't look at which school you're coming from unless they already have students from that school and they know that that school is great. So the short answer is if you have an ERAS token, then it is already understood that the school's been approved as as an acceptable school from ERAS and NRMP and all that. So if you have that, you don't really have to think about what program directors will look at. They are looking more at you.
Thank you so much, because that's something that is reassuring. And you might have noticed from one encounter we had with Ethiopian resident, Ethiopian medical students are very much resilient. They are very much brilliant, and they excel in every setup.
No, you
So, so the other question is, can having multiple publication, example, I have 24 publications as PI, correspondent, and co-author. Would this be a negative factor for application to a hospital program?
not at all. Not at all. As long as they're genuine, I'm actually proud that you have so many publications. And you will be an asset to any program. So it doesn't matter if that program does not have research, but what matters is a candidate like you has even applied to that program. So it is good to have uh, these publications, and it is okay to share them irrespective of what type of program you're applying to.
Thank you so much. The next question is, would incomplete home-based residency be seen as a lack of commitment if we decided to discontinue it to pursue USMLE?
No, no, I don't think they would judge you based on that as long as you have a valid reason why. If you say you started it and you've always wanted to get to the US and you got the opportunity this time and that's why you had to let go of it to move here, then yes. Uh, and most of the times that's why yeah, it happens. But let's say you quit because they fired you and then you moved here, then that's going to be a little bit of a red flag.
That's for sure. I think knowing ourselves and our journey and narrating it in a good way is what makes us be good applicants. Okay, I think the last question is, do you recommend that dual applicants be upfront about applying to multiple specialties in their personal statement or interviews?
No, I would encourage you not to share that you are applying to multiple specialties anywhere. I multiple applying to multiple specialties is not uncommon, which all program directors know. But that application to multiple programs should be something that is personal and you should just keep it to yourself and just go to the program that you've applied for if you get an interview and you don't have to speak about the other specialty that you applied to. That's only going to make it a negative for you.
That is so true. Uh, so okay. Um, so well, so what should we work on before joining residency to move to make transition earlier? You have touched about it, but if you can briefly tell us more about it.
So I would encourage you to see there are two ways of doing this. One, check out our webpage. Let me send you the link, or Sega, if you could, let me add that.
Yeah,
Hold on.
that would be good.
Let me add that. So this link that I'm sharing right now. Okay. So this link that I shared right now, it's called Residency Readiness Bootcamp. It's a course that our company offers. One, you can sign up for this course. It's a 2-day boot camp. We have one session in New York, New Jersey area in the month of May. And then the second one we have in the month of April in India. If you cannot afford it or you don't want to do it, you can just take the topics that are listed in this boot camp and prepare on your own. But one thing I will tell you, preparing on your own is not that easy around these topics because you will have to go across the internet to try to find the right material. And then you will have to actually know what to actually learn about these topics. So, but you can try. That is something you can definitely try. That is why I shared the website because one, we offer it. But two, if you can't do it, just take the topics and go learn yourself and become successful.
So I see two questions. I have seen some people from Ethiopia with above average scores and not getting many interviews. In your personal experience, what do you think would be the possible reason specifically from Ethiopian IMGs?
Yeah, so I have seen students with good scores, like you said, Yared, but I am thinking their application did not have other details properly put together. So, for example, when you see US clinical experience section, they might have chosen the wrong practice type, or they might have chosen what they actually gathered from it. I have seen some of the students not properly write the details of that experience. So some of those things would definitely have impacted how many interviews they have gotten so far. And this year has been a little tough for a lot of people. I have seen students with scores of 238, 239 getting only one interview. I've seen students with 240s getting five, six interviews too. So it's so mixed. I can't tell you why, but uh, those are some of the things I can think of why they might have not gotten an interview because their application might not be that strong.
Thank you so much, Doc. One thing I noticed about Ethiopian applicants is we tend to focus on step one and step two until September. And we rush during September to finish the applications. And as a program director, you might have noticed you just don't just look at the scores, but you look at the person as a whole.
Mhm.
So that is one thing I noticed. Many of us pushed our application in feeling ERAS application until September. It might be because we were not aware of it. I hope this meeting would give an awareness that we need to start writing our personal statement and experience early on. Even applying for next year, we need to start right now along with our studies. And another misconception is if we get a good score on step two, that's the only thing we need to secure an interview.
Mm.
Or like, so that's not a good thing. So there are other things like being FMG certified on time, and even if we have a grammatical error in our personal statement, that's like a huge
Yeah.
red flag for a program director to see. And so we need to make our application so neat. And for that, we need to do it early on, because when we prepare such things in a rushed period of time, it will not obviously explain ourselves. So we need to take time, I think. Um,
And one more thing is, uh, if there are students in medical school right now, you need to start working on yourself from medical school time. If you don't have stuff, what will you fill the application with? Nothing. So you really have to build all of that stuff for the application. So do work on yourself to get to that level. Like Sega said, just having a 250 score is not enough these days. It is still enough in some programs. I don't disagree with that. There are some programs that are purely based on medical knowledge, uh, as a demonstration of students through scores and stuff. It is still an option, but yeah, it's limited, right? And it also then gets limited if you're looking at specialties. Let's say you're saying, oh, I'm going to look at surgery, I'm going to look at radiology and all of that, then obviously it's going to be very hard just with scores.
That is so true. So just to give a 2-minute highlight about USMLE exam, because I've taken it recently, I wanted to share my experience. For step one, make sure to take time and make sure to develop that consistency and commitment, as well as, developing ourselves in our body to sustain ourselves to stay for a 9 hour long exam. So we need to develop the skills to have the body strength even to continue that long. Another thing is we need to know the specific references that are needed. We shall not dwell on other research, like other resources. It would just be a waste of time and energy, and it will just delay the time of taking the exam. So make sure to have a specific reference which is good for you. So for the earlier few weeks, make sure to explore the references and find a good one that matches good for you. For example, if you are a video person, try to explore the videos needed for step one. If you are just want to read, try to do that as well. Try to discover the resources on that aspect as well. And if you are like a question person, try to practice early on. So that's one example, one thing I would like to take. It's not about having a lot of resources, but about being focused on one specific resource. Another thing is make sure not to delay it. So with my experience, I tried to finish in short period of time because I made it a dedication. So it might come with a sacrifice. So know your sacrifices, and it might come with challenges as well along the journey. So make sure to motivate yourself. If you are motivated with groups or with your friends, make sure to reach out to those friends. And if you are just wanting to read alone, make sure to do that efficiently as well. So out of step two, so step one, people would consider it as a pass or fail, but I'm sure many people are failing these times. One reason is because people are not being prepared to take the exam. They just want their aim is just to pass. If your aim is just to pass, the margin of error is going to be really small. So make sure to aim to get high score and to pass that aim as well. For step two, make sure to take your time. Make sure to do the assessments well before you take the exam, and similar pattern as step one. So the thing you did in medical school and for a step one exam is the same thing for step two. So another thing needed is OET, Occupational English Tests. Luckily, we have there is opened exam center in Addis Ababa. So you can take it there if you want. And so make sure to practice your English skills early on and make sure to take a time even to take that exam. I've seen some people struggling to pass that exam because they take it lightly, and make sure to pass on the first attempt as well. And then get your SFMG certification early on. I say before September, so that you'll just be focused on filling up the ERAS application during September. So that's some of the things I wanted to say about USMLE.
No, thank you. I think there's one question here. What is a good way to frame our weakness without affecting our application, right? That I think we start there, right? Yeah.
Yes.
So one way to frame our weakness without affecting our application is by showing what happened and then sharing what you did to overcome it. See, mistakes happen, situations happen, but then one, you have to figure out if you want to share it. And if you do want to share it, then you have to figure out what are you trying to tell them by sharing it. Like if you're just going to share information and say, hey, FYI, it's not going to help. But if you're sharing it and you're saying, this happened to me and I realized this and I worked on it and I have overcome and I have achieved this, excellent. So, two answers to that question. One, sharing a weakness if it is necessary. I think we should go ahead with sharing it. And then when you share the weakness, you always also share what you're trying to work on to make that weakness stronger or go away.
Thank you so much, Doug. I've seen a question that says, would taking step three be an advantage or disadvantage for someone scoring 240 in step two?
Step three will always be an advantage for IMGs. The quicker you take and make sure to pass. So it is always going to be an advantage. Step three score is not being looked at this time as one of a factor, but passing step three will always be an advantage for IMGs.
That's for sure. So the second question is, can someone who did certain specialty in home country residency apply to a different specialty?
They can, yes. So As long as you have one LOR from the specialty of choice that you're applying to, and you have LORs from other specialties, that is okay. But if you don't even have one LOR and you're just applying out of the blue to a different specialty, then that doesn't sound appropriate. And if you can explain why you're moving from one specialty to the other, then people still understand. For example, I've had students who done OBGYN in their home country and they did medicine here. I've had students who were neurosurgeons and did anesthesia here. And they shared that it's hard, it can get in, and I still like anesthesia, so that's why I'm doing this. Yeah, is it going to be different from a standard application? Yes, for sure, right? I mean, but will it be hard or will it be negative? I personally don't think so, as long as you have proper explanation.
Thank you so much. The other question Yarid asked was, okay, uh, what three things other than score would you advise us to work on to accomplish for the best outcome on gating interviews and matching?
So, yeah, if you want to get interviews, you have to have a compelling application. If you have to have a compelling application, you have to have good scores, good personal statement, and additional experiences that can tell about you as a person holistically beyond the score, beyond the personal statement. Now, what additional things will tell about you are individual specific. Like I said, the standard ones are research, volunteership, leadership domains. If you have anything around those, you need to highlight those. If you don't have around those and you have something unique, different from others, you should highlight that. So that's what is going to bring you to that table for the interview. Now, what will take you to the next step is how do you do in that interview? I have had students who had scores of 270s. They come to the interview and their interviews are not that strong. Then I start thinking, do I really take this student who has 270s and cannot communicate versus a student who has 240 and can communicate? So that's the next step. So once we get all of those, then you get the ranking. Now, we didn't talk about one topic here. How do you define the rank order list? So I will tell you my 2 cents on the rank order list. See, preparing a rank order list is very important. Let's look at it from two angles. See, when candidates are deciding on a rank order list, it is essential to factor in the alignment of their aims, interests, goals, and the program's aims, interests, and goals. Let's say Sega wants to get into Harvard, and that's her, interest, dream, everything. Sega goes and interviews at Harvard. I'm just saying, I know it's a hypothetical statement. It's not about a program or anything like that. And then some of the aims of Sega and some of the aims of this big program might not match. Then then Sega goes to another program, let's say program Y, where her interest is less on that program, but that program's interview went superb. Sega was so happy about that program's interview that she just the ground was just swept away from under her feet. So now, which program should Sega rank first? Harvard or the program Y? But Harvard also it went well, but the ground didn't get swept off in Harvard. So it is important that you choose the program where you've had good interview and where you've had a good experience. So that's how you want to rank it. Don't rank completely based off what your likings are. Make sure to factor your likings, make sure to factor your interactions and interview, and then pair up both of these things, and then you figure out your list. It's not easy. It's not, you know, I'm saying it so easily, but I understand when you get to that rank order list, it's going to be challenging for you. But do your best to match what you wanted versus what you got and figure out a list.
Thank you so much, Dr. Mannuru. My last question is, do you think doing telerotation has an impact on matching?
Any rotation will help. So, as long as that rotation brings out what you took away from it, from a US healthcare or a US clinical experience standpoint, it will help if you are able to highlight it.
Great. I think that's all of the questions. Um, I'd like to say thank you so much, Dr. Mannuru, for giving us your time and your energy, you know. I see one question. Okay, why do most of the IMGs match only to internal medicine? How feasible is matching to other less competitive specialties like psychiatry and family medicine for IMGs from Ethiopia?
So, uh, I am internal medicine has the largest pool of positions.
Yeah.
So that's one big thing why a lot of people match there. Uh, Two, internal medicine has also been quite IMG friendly for a number of years. So these are the two big reasons why a lot of candidates match into internal medicine. And the third big reason is internal medicine also gives you the opportunity to expand into subspecialty. There are close to 16 plus subspecialties that you can go into if you did internal medicine. So these are the three big reasons. One, it's a large pool. Two, IMGs have matched in internal medicine quite a lot. And three, you have the opportunity to subspecialize a lot through internal medicine. So that's why you see many people gravitate to internal medicine. Now, the other specialties, psychiatry, family medicine, they still take IMGs. Ethiopian grads, I don't know the distribution on like, okay, where do they go? But one space I can share with you that you could look up all of this data is called as NRMP match results. Let me put that in the chat box. That'll kind of give you where you should look up this data, and it'll help you more on further things. So when you go to, let me pull it up 1 second. So yeah, okay, there we go. Okay.
Thank you so much, Doc. Will make sure to share it on the groups as well?
Mhm.
Yeah. So I see another question, but it was answered during our discussion. So you can watch the recording if you didn't get to listen to the answer. So thank you so much, Dr. Mannuru, again, for
Thank you.
thinking of Ethiopian society, thinking of Ethiopian applicants, and reaching out to support us with that regard, with your expertise. Thank you so much.
Thank you, Sega. Thank you for putting this together too. This could not have happened without your assistance and your efforts. Uh, I truly appreciate your interest in supporting others in their journey and not just focusing on yourself. See, that talks about your leadership. So this is something that you look at in a candidate. For the audience, see, Saga, she could have just kept going with her life. She didn't have to do this, but she chose to do this. So that is called leadership. So that is what I am also looking at in candidates. So that's what program directors are looking at when they look at applications. So uh, all the best. And thank you very much, Saga. And I wish you good luck. And please do tell students to at least follow CPFS and us on LinkedIn and other platforms because we do post a lot of information every time it comes up. So it's free, it's not charged. So at least you do get some genuine information. And I don't put my personal opinions. I'm not a personal opinion sharing person because I want it to be as unbiased as it can be and as objective for the students.
Thank you so much, Dr. Mannuru, again,
All the best. Yeah.
for
Thank you.
everything. Have a good day.
Good
And
luck,
for
all.
all the applicants, good luck as
Yes,
well.
all applicants, good luck. Wish you all the best. Remember, um, this is just a journey. Don't take it personal. This does not define you. This does not tell who you are, whether you get, you don't get. Uh, it's just a journey. So remember that uh, there's a lot in our own countries also. There's a lot you can do everywhere. So please just do your best, work sincerely, make sure you do whatever you can. But at the same time, don't get disheartened. Yeah? That's very important. I matched the second time, not the first time. And I did have good scores. It wasn't like I didn't have good scores, but I didn't know the holistic picture was looked at. Even second time, I didn't have that big of a holistic picture, but I was blessed I got in. But now I learned all of those things. So my 2 cents, work hard, but don't make this your life. This is not, this doesn't define you. Remember that.
Thank you again, Dr. Mannuru. Thanks so much. Thank you, our attendants, for dedicating all your time to listen to our journey in Dr. Mannuru's expertise. Have
Thank
a
you.
great day.
Bye, Sega.
Thank
Thank
you.
you.
So